So moving on to eating for eye health. So obviously don't start supplements without consulting your GP, optometrist or ophthalmologist first. So when you think about eating for eye health, the first thing that springs to mind for most people are carrots. So carrots, they are very important, and that's true. They have a role for night vision, and there's a good source of vitamin A, not just carrots, sweet potato and melon. And they have a role for in night vision and also to keep the surface of the eye clear. But it's not just vitamin A. Moving on, antioxidants, so vitamin C and also vitamin E, not to forget that too. They have been shown that they can delay the onset of cataract formation and macular degeneration, and they have a crucial role in eye health. Omega-3, so specifically if you have dry eye disease, which affects about 1 in 4 of the population, and the number one cause for it is a condition called blepharitis, where the glands between the lashes are clogged up, and they secrete the oily layer of your tear film. Omega-3 has been shown if you take 1 gram a day, after 6 to 12 weeks, it would improve the quality of the secretions from the meibomian glands and improve the symptoms of dry eye disease. So if you were on a desert island with dry eye disease, the one supplement you want to be taking would be omega-3. And you can get it naturally from salmon, tuna, etc. Now, lutein and zeaxanthin are nutrients that maybe not everyone here knows about, but they are not made naturally by the body, and they have a key role in macular function. So in the back of the eye, in the retina, your macula has the highest concentration of cells that enable us to process light, cone cells. So it's very important that these cells are functioning to protect sight. And essentially, these two nutrients have been shown to help that region, and essentially they're in kale and leafy greens. And if you don't feel like you're eating enough, this is the recommended dose that you should be taking for macular health. Selenium, so that has a very important role in thyroid function. So if you do have a history of thyroid eye disease or any type of thyroid dysfunction, you may want to start taking selenium, either supplements or Brazil nuts have quite a high concentration. So zinc, this has a high concentration in oysters, and again has a very important role in eye health, so you may want to think about that too. Vitamin D is interesting. So there has been a lot of evidence to show that vitamin D is very important for general health, and there's very little bad advice coming out with vitamin D. So it's not a surprise that it also has a key role in eye health, particularly for dry eye disease. So overall, the key thing really is to follow a Mediterranean diet, and this is actually being published to reduce the risk of advanced macular degeneration. And this is a large multi-center study, international. So if you were thinking of starting some supplements for eye health, when you go to a pharmacist, Boots, essentially have a look around at there's a lot of different brands out there, but the key thing is just to turn the package over and check that they're actually following the AREDS 2 formula, because that was the very large study, and then you can start taking them.